Good morning, Dr. Ida Khanam from Pediatric Board Concierge Pediatrics in Bel Air, Houston, Texas. So I wanted to come on board and just talk a little bit about parents who are expecting a baby and what to expect when the baby is born. I mean, what do I recommend when they are newly born? What should they get? And one of the big things is the vitamin K shot. The reason I'm bringing this up is that it is becoming a little more common where families are for some reason refusing it in the hospital, even though they've had other children who've had it. And then they'll come to the pediatrician's office and say, okay, wait, now the child is a week out or 2 weeks old. And they're like, okay, maybe I want to get the vitamin K shot. So firstly, I want parents to know, most general pediatrician offices do not carry vitamin K because it is not one of the things that we routinely do. It is usually given in the hospital at the time of birth because the reason is babies are born with low levels of vitamin K, which is used in the clotting factor, so preventing bleeding. That's the reason why you give it, so that if, God forbid, your child hits their head or gets hit in any form by accident, they don't have an internal bleeding, and the biggest, scariest one would be a brain bleed. So that's why it happens right at birth. But if somebody refuses it and then decides, when they go back to their pediatrician that they would like to get it, I will tell you, most pediatricians do not have this in the office, and it is hard to get a hold of. And so what happens is then they're like trying to figure out where to send you, and usually have to send you back to the hospital to go get it done. So something to think about. Please make sure you do a little bit of reading, ask the appropriate questions before your baby is born, so you are making sure you are getting your child the appropriate things before they get discharged from the hospital.